Good morning. A new video for my friends and followers on the health benefits of the Mediterranean diet. What do we know? What is a Mediterranean diet? Well, the Mediterranean diet, by definition, is the diet of all the countries that are facing the Mediterranean Sea. As you can see here, this beautiful sea. And there are many countries from Spain, France, Italy, Croatia, Albania, Greece, Turkey, Lebanon, Israel, and Tunisia, Libya, and Egypt, and others. And these dietary patterns have been there for centuries, and even if they have some commonalities, they are quite distinct. Even within Italy, there is a difference between, diet of Liguria compared to Sicily, Calabria, Puglia. However, the Mediterranean diet was started to attract scientific attention only at the end of World War II, when Ansel Keys, this scientist, this US scientist, who, by the way, lived 100 years. He was born in 1904 and died in 2004. He went to Naples, invited by a professor of a major hospital in Naples to study the lifestyle, or better, to study why at the end of World War II, myocardial infarction, so heart attacks, were very rare in South Italy, whereas they were very common in US and in many North European countries. Again, in 1954, we didn't have a clue why there was this major difference in the incidence and mortality for heart attack. So again, Ansel Keys with his wife traveled from UK by car to Naples. And when in Naples, he started to visit the hospitals, the local hospitals, and he couldn't find any patient admitted for a myocardial infarction. Even if in a later paper, he tells the story that myocardial infarction in the private clinics where the wealthy Napolitan citizen from Naples not lived, but they were admitted, there were several cases of myocardial infarction. It was just in the normal people, that myocardial infarction was pretty rare. So he measured cholesterol, and he found, cholesterol was much lower, in the order of 170 milligram deciliters in the people of Naples in 1954. And he started to study what was the difference, for example, in diet. And as you can see in this paper, he describes the diet of these Napolitanian men and women at the end of World War II. Meat, fish, milk, cheese, and eggs were definitely luxurious food. The great bulk of diet was bread and pasta. As you can see, he states macaroni and spaghetti. I can tell you it was homemade bread and homemade pasta, not with refined flours, but with whole grain flours and local vegetables. Sugar and potatoes were eaten only in very small amounts, and butter was never used. Extra virgin olive oil was the dressing for all these salads and meals, and fruits and very small amounts of cheese were quite regularly consumed. Again, meat was eaten probably once a week, once every 2 weeks. That's what he reports in several papers, Ansel Keys. And just visually, this is typically the Mediterranean diet, the traditional Mediterranean diet of my grandparents that are from South Italy, from Calabria. In contrast, this was and is a typical meal of North European and North Americans. I don't have to describe the difference. And more recently, this is the transition from this one, the modern transition, where you have a lot of refined carbs in the bun and the potatoes. Indeed, a friend of mine told me, that consumption of vegetables in the US is pretty high, but the vegetables are potatoes and refined breads and ketchup and then high corn syrup beverages, so soda. Now, in this 7-country study that Ansel Keys initiated with other colleagues around the world, he found that serum cholesterol was linearly related with the risk of dying of coronary disease. And, with Finland, US, Netherlands having a much higher risk of dying of coronary disease because they had much higher cholesterol than people in Japan, in Crete, and in South Italy compared to North Italy, where the risk was higher. Again, this was just the beginning of this understanding of the relationship between consumption of animal fat and serum cholesterol and coronary disease. There are tons of epidemiological studies describing the relationship, the association between the consumption, the adherence to a Mediterranean diet and the risk of developing and dying of coronary disease and even cancer, like in these famous studies published in New England Journal of Medicine in 2003, showing that these 44 months of follow-up, and men and women that were consuming more vegetable, legumes, fruits, nuts, seeds, whole grains, and fish, and less meat, poultry, and dairy products had a approximately 30% lower risk of coronary disease and mortality in general. Of course, as we always discussed, association doesn't mean a cause-effect relationship. Now, there are a number of randomized clinical trials that by definition can demonstrate a cause-effect relationship on the effects of the Mediterranean diet. And I'm going to just describe 3 of them because otherwise we'll take many hours. So this is the PrimaMed study published in New England Journal of Medicine, showing that men and women at high risk of myocardial infarction who were randomized for 5 years to a Mediterranean diet with extra virgin olive oil or nuts, as you can see here, nuts and extra virgin olive oil in green, had a significantly lower risk of major cardiovascular events, but in particular of stroke than controls. Then there is a study published by Singh on Lancet in 2002 on people with at high risk or that had already had a myocardial infarction, and they were randomized to a Indo-Mediterranean diet. And as you can see here, those that were randomized here to the Indo-Mediterranean diet had a 50% reduction in the rate of non-fatal myocardial infarction and a 60% reduction in the rate of sudden cardiac death. Finally, I want to discuss the LION study. This is a secondary prevention study of people that had a myocardial infarction and were randomized to a Mediterranean diet or an American Heart Association Step 1 diet. And as you can see here, there was a huge 70%, 76% reduction in the risk of cardiac death in those randomized to the Mediterranean diet. And they had to stop the study much earlier than what it was planned because it was unethical to continue the study because of this major effect of the Mediterranean diet in preventing a secondary event and the death due to a reinfarction, a new infarction of the myocardium. Okay, so this is just an introduction. Now let's discuss some of the mechanisms that are responsible for these beneficial effects. So it's very complex, and if you want to read more and have a number of references supporting what I'm telling you, you should read this review article that I wrote for Journal of Gerontology, discussing again the different mechanisms through which I think a Mediterranean diet is contributing in the prevention of several chronic disease, in particular coronary heart disease. So the number one mechanism is not the number one in terms of importance, but is the first one, has been studied and discussed by Ansel Keys and supported, as you can see here, by many other scientists with many studies, both epidemiological, and there are a number of randomized clinical trials have been conducted many years ago, showing that the higher the intake of saturated fatty acids, that are the fat typically of animal products, cheese and milk and the meat in general, the higher the concentration of LDL cholesterol. There is a linear relationship. So the more you eat saturated fatty acids, the higher the cholesterol. By the way, even olive oil has saturated fatty acids, okay? So be careful. So on average, for every 1% increase in calories from saturated fatty acids, there is a 2% increase in LDL cholesterol, in plasma LDL cholesterol. A new mechanism that we have been studying for the last years is the role of certain amino acids. The amino acids are the components, the bricks that form proteins. Certain amino acids, in particular brain chain amino acid and sulfur amino acids, it seems to push cardiovascular disease by causing insulin resistance and glucose intolerance. In this study that we published with Dudley Laming in Cell Reports in animals and humans, we see basically that a lower protein diet or a lower intake of brain chain amino acids, independently of calories and protein, is reducing blood glucose concentration. So basically the type of amino acids that you are consuming have has an effect on your fasting glucose. That is a major risk factor for cardiovascular disease with insulin resistance. To support this study, there is another study by Bettina Mittendorfer from Washington University. In this study, Bettina randomized obese women to two groups. Well, three groups, but the two intervention groups, controlled two intervention groups, are women that lost 10% of their body weight on a normal protein diet, 0.8 grams of protein per kilogram body weight, and another group who lost 10% of their body weight on a high protein diet, 1.3 grams of protein per kilogram body weight. The extra protein was provided by feeding these women whey protein, rich in branched chain amino acids by definition. And both women has a similar reduction in liver, in visceral fat by MRI, in liver fat by MRI. However, only the women who lost 10% of their body weight on the normal protein diet had a significant improvement in insulin sensitivity measure with a clamp. In contrast, the women who lost the same 10% of their body weight, same reduction in visceral and liver fat, had zero, let me repeat, zero improvement in insulin sensitivity. And again, this is a study, a very well conducted study using the gold standard to measure insulin sensitivity by a group of scientists, Bettina Mittendorfer and Samuel Klein, who are world expert in clamp studies. Therefore, these studies are further supporting my concept that independently of calories intake and body weight and liver fat and visceral fat, a high protein diet, especially a high whey protein, branched and amino acids, is impairing metabolism. Therefore, these women, despite weight loss, they are still insulin resistant. And because they are insulin resistant, they have compensatory hyperinsulinemia. And because, as I have explained in several videos, in several of my videos that you can find on YouTube, these women have an activation of the insulin AKT mTOR pathway that is driving insulin resistance, cancer, and aging. As you can see here, we have demonstrated that in yeast, worm, flies, and mammals, if you downregulate the insulin IGF mTOR pathway, you have an extension of lifespan across species. So there is a ancestrally conserved mechanism linking nutrition and the activation or inhibition of the insulin IGF mTOR pathway and longevity and health. Another mechanism that we think is important is the processing of the food of the Mediterranean diet food, or vice versa, of the typical Western diet, animal-rich food and fiber-poor diets by the gut microbiome. As you know, we have trillions of germs, bacteria, viruses, living in our gut. And as we have shown in this paper published in Science 2011 by Jeffrey Gordon groups, I was a co-author on this paper, not only in animals, but even in humans, among all the nutrients that are regulating the composition and function of the gut microbiome, protein intake and insoluble fiber are two of the most important nutrients. And because a Mediterranean diet is low in animal products, is more a plant-based diet and low in animal products, this diet is producing less TMO, because when a diet is rich in meat and dairy, these diets are rich in choline and L-carnitine that get processed by the gut microbiome in our intestine to produce a metabolite called TMO that is promoting atherosclerosis through different mechanisms, not only in animals, as published in this Nature Medicine paper in 2013, but also in humans, where in this New England Journal of Medicine paper 2013, we see that men and women that had higher circulating concentration of TMO had a 20% higher risk of myocardial infarction and stroke than those with lower levels of TMO, demonstrating, that through the processing of these animal-rich food through the gut microbiota is promoting atherosclerosis independently of the classical cardiometabolic risk factors. In contrast, a diet rich in fibers, and the Mediterranean diet is very rich in fiber. Indeed, typical Mediterranean diet has at least 45 grams of fiber per day compared to the 15 grams of a typical Western diet. What we have started to understand by using animal models of disease is that a diet rich in fiber, this fiber get digested by the gut microbiome to produce metabolite called short chain fatty acids that are binding to specific G-couple receptors on the epithelial cells and the immune cells of the gut. And this is reducing inflammation, is inhibiting NF-κB, is promoting the growth proliferation of T regulatory cells that are important for the prevention of allergic disease and autoimmune diseases. Basically, a diet that is poor in fiber, like many Western refined diets are promoting a dysfunction, a dysregulation of our immune system with a pro-inflammatory, pro-autoimmune immunological pattern, and this is probably responsible, at least in part, but for the increased incidence of allergic and autoimmune disease like multiple sclerosis, type 1 diabetes, inflammatory bowel disease, and many others autoimmune diseases that are becoming more and more common in our modern societies. Other mechanisms are, for example, for lowering cholesterol, that a lot of plant-based, whole food, plant-based food are rich in sterols, in plant sterols that are competing with cholesterol, and therefore they are reducing the absorption of cholesterol and plasma cholesterol concentrations. A typical Mediterranean diet is rich in fish, particularly in South Italy, we're rich in sardines and other bluefish that are very rich in omega-3 fatty acids. And from many studies, including randomized clinical trials, we know, that omega-3 fatty acids have a powerful lipid-lowering effect on triglycerides. They have an antiarrhythmic effect, so they are reducing the risk of arrhythmias. They have a moderate effect in lowering blood pressure and in anti-thrombotic, in preventing the formation of blood clots. By the way, fish is a very good source of proteins and omega-3, as I said, but also vitamin B12, especially seafood, clams, 100 grams of clams, for example, contain approximately 100 micrograms of B12. That is a very important vitamin. Basically, this is 4,000 times the RDA for the daily RDA for B12. So a very good source of B12 and zinc. As you can see here, a Mediterranean diet that is very colorful is rich in a number of important phytochemicals, vitamins and minerals and phytochemicals, and each group of vegetables has a peculiar family of phytochemicals. Carrots are rich in vitamin A and polyacetylanes, and cabbage family, they're very rich in vitamin C, K, E, and isothiocyanates that are very important for cancer prevention. Beans are rich in a number of phytochemicals, in particular isoflavones and lignans. Brazil nuts is a very rich source of selenium and whole grains, and orange, lemons, So there are different phytochemicals. So the more diversity in your diet in terms of vegetables and whole grains and beans and nuts, the higher the variety of protective phytochemicals. But be careful, because as always, the idea that, if something is good, if one bottle of wine is good, drinking 100 liters of wine is better, as you can imagine, is wrong. Is a wrong concept. Unfortunately, it's quite common in our societies. Let me give an example of what I want to say. So extra virgin olive oil is a very good dressing, because unlike cream and lard, is composed mainly by oleic acid, monounsaturated fatty acids. It's also very rich in phenolic compounds like tyrosol, hydroxytyrosol, vitamin E, carotenoids, that are protecting this oil from oxidation. Extra virgin olive oil is also very rich in a compound called Oleocantal, especially the newly pressed extra virgin olive oil. You know that your olive oil is of very good quality and is fresh because of the intense irritation. So if you eat olive oil, good olive oil, there is like a stinging sensation in your mouth, and this stinging sensation is positively correlated with Oleocantal concentration, as this Nature paper clearly shows. And what this scientist has shown, that this stinging sensation chemical, Oleocantal, is a natural anti-inflammatory compound that has the same potency and profile strikingly similar to ibuprofen. Ibuprofen is one of these anti-inflammatory. Of course, the concentration of Oleocantal in the olive oil is not enough to exert an anti-inflammatory effect, but as baby aspirin, if you have a regular consumption of high quality extra virgin olive oil, you have the anti-platelet, the anti-aggregant property of ibuprofen by consuming a right amount of olive oil, extra virgin olive oil of good quality. The problem is that 1 tablespoon of olive oil contains approximately 120 kilocalories. So when Ansel Keys went to South Italy, people in South Italy were consuming 1/3 of their calories from olive oil and wine, but they were also engaging in very heavy exercise, 8-9 hours a day of hard, physical activity. But nowadays, instead of we have a sedentary lifestyle that in some extremes is really becoming zero physical activity. People, they go from their house with the elevator to their car, from their car elevator to the office, office elevator, car, car elevator, apartment. And therefore, if you, on top of your regular calories, you are abusing, you are eating, consuming an excessive amount of olive oil, again, you know, 5 tablespoons of olive oil is going to be around 600, 700 calories, extra calories. You're going to gain weight. And if you're going to gain weight, your risk of developing chronic disease increases linearly. This study by Willett and colleagues, published in JAMA 2017, shows that starting from 2.5 kilos of weight gain in adulthood, in early adulthood. So, you know, when you are around 18, 19 years old, 20, most people, they stop growing in height. And then many people, unfortunately, they gain between half a kilo, 1 kilo per year. And therefore, the study shows that starting from 2.5 kilos, each increase in, in 5 kilos is increasing the risk of chronic disease in both women and men. And it's very easy. And you don't have to be obese. The concept is that you don't have to be obese. Unfortunately, many doctors and many health professionals, they recommend their patients to take care of their body weight only when they are obese, only when their BMI is higher than 30. In reality, this study by Willett suggests that, you know, if you take a girl that, you know, when she's 20 years old, is 55 kilos, let's say her height is 170, 55 kilos, her BMI is 19. This is like a college student, fit college student practicing, I don't know, sport, swimming or running. If after college or during college she gains 5 kilos, her BMI is still 20.8. If she gains 10 kilos over, let's say, 10 years, and she's now 30, her BMI is 22.5. If she's gained 20 kilo by year when she's 40, her BMI is still 25.6. So it's basically almost normal because the cutoff for normal body weight is 25. Only if she gains 30 kilo, her BMI is going to be around 29.4. So it's still at the upper limit of normal, of overweight. But as you can see here, going from a BMI of 19 to 22.5, this is a 10 kilos weight gain. And the risk of every 5 kilos of weight gain during early adulthood or middle adulthood is huge for type 2 diabetes, cardiovascular disease, some obesity-related cancer like breast cancer, endometrial cancer, colon cancer, pancreatic cancer, esophageal cancer, and many other ones. The risk of gallbladder disease, it's much higher, and gallbladder disease is a major problem for acute pancreatitis that can be deadly. Osteoarthritis, cataract, and most importantly, as you can see here, there is a major reduction in the probability of healthy aging in those who have gained 5 kilos. For each 5 kilo, there is a reduction by probably 20% of the probability of having a healthy aging. Okay? So to keep your body weight healthy and avoid to gain weight as you age, you need to combine exercise and a healthy diet. I don't have time to go into the details of, in this video at least, of the mechanisms through which exercise is important for promoting health And I don't have time to go into the difference between calorie and composition of the diet and meal timing and frequency. But believe me, you have powerful instruments that can help you to protect yourself and reduce the risk of developing many chronic disease and live a long and healthy life. And remember that many of the common chronic disease we see in our hospitals are not separate entities, unrelated entities. There is a common metabolic substrate that is responsible for many of these common chronic disease, from cancer to fatty liver disease, vascular dementia, stroke, coronary disease, and chronic nephropathy, of course, lung cancer and diabetes with all the complications, and several risk factors, as I have, for example, written in this review article on Nature Review Cardiology. And for lay people, if you are interested in my recent book for lay people called The Path to Longevity, I explain how these lifestyle factors are impacting this common metabolic substrate. And of course, diet and exercise are only two of the important components of a healthy lifestyle, but cognitive training, sleep and meditation, phytochemicals and smoking medication, sun exposure, and other ones are also very important, again, as I explained in my in my papers and in my books. Let me end with this slide. As you can see here, these are data from NHANES. The average lifespan is greatly different in US among people who are, for example, non-Hispanic Black males. These are non-Hispanic white males, and Hispanic females have a much higher, longer healthy lifespan than for example, Black females. And non-Hispanic Black males have the shortest compared to Hispanic males. So I think the aim of medicine shouldn't be to treat disease after they have occurred, but it should be to promote healthy longevity. Ideally, we would like to have people living a very, very long and healthy life, and only in the last few months of their life to have problems, and that they're gonna end their life without pain, and also based on the data we have, this deceleration of accumulation of molecular damage, accumulation is also most likely extend maximal lifespan. So people that are going to live longer and healthier. Again, you can follow me on my YouTube channel, where I have a number of videos. You can also follow me on my Facebook and Instagram and Twitter accounts. And if you're interested in these topics, you can read a book that I wrote recently called The Path to Longevity, summarizing all the science and evidence about how lifestyle, diet, exercise, mind training, emotional health are important for promoting a healthy, long, and fulfilling life. Thank you for your attention. If you have liked this video, just click on I liked it and share it with your friends, and thank you.